My name is AnxietyA1, a student of University of Texas, Rio Grande Valley. I am in the Psychiatric Mental Health Nurse Practitioner Certificate Program. This is my PowerPoint presentation for evidence-based presentation for NURS 6260, Theoretical Diagnostic for Mental Health and Substance Abuse Disorders. Dr. Richard Diaz is my instructor. My evidence-based presentation topic is on the effectiveness of exposure therapy in treating anxiety-related disorders. I will start with introduction. What is anxiety? Anxiety is a chronic disorder characterized by an excessive and persistent sense of apprehension that may be accompanied with physical symptoms such as sweating, palpitations, and feeling of stress. So anxiety disorders are those disorders that share features of excessive fear and related to behavioral disturbances. Fear is the emotional response to real or perceived imminent threat, and anxiety is anticipation of future threats. The prevalence of anxiety in our community cannot be overemphasized. Anxiety is one of the most diagnosed mental health problems. Anxiety is felt in almost every home across the globe. At one point or the other, a human being will have some episode of anxiety. Currently, I have anxiety with this presentation. My test that I took today. Anxiety, is part of our human existence. But if it becomes a mental health issue, that's when it is frequent and the individual experiencing the anxiety is unable to function effectively in their day-to-day activity or have reduced productivity due to anxiety. The DSM-5 points out that there are various categories of anxiety and anxiety-related disorders, such as social anxiety disorder, PTSD, panic disorders, agoraphobia, generalized anxiety disorder, and many more. Anxiety disorders are considered the gateway disorder for many adult psychiatric disorders. In this presentation, I will focus on the effectiveness of utilizing the different kind of exposure therapy to treat various types of anxiety-related disorders. I selected 6 peer-reviewed research articles which I have read and critically outlined the vital sections for my evidence-based presentation. Okay. I've described what's anxiety already. So I will point out some types of anxiety disorders that we have. We have the generalized anxiety disorder, which is excessive anxiety and worries, apprehension, and expectations, occurring more days than not for at least 6 months. These individuals will find it very difficult to control their feelings of anxiety. To disturb them, they might have sleepless nights and things like that. They will not be able to function normally. We have PTSD, which is an anxiety disorder or syndrome or symptoms associated with experience of an individual after a traumatic event have occurred in their life. Any stressful incident that endangers the safety of an individual can cause PTSD. PTSD, although, is frequently associated with military wars, but generally, any devastating life event causes PTSD, most especially if the incident is perceived as impulsive or uncontrollable. Situations like military combat, being trapped in a cave, work-related accidents, sexual abuse or assault, physical abuse, and many other things can lead to PTSD. Now, social anxiety disorder. That shows a marked and feared anxiety about one or more social situations in which the individual is exposed to possible scrutiny by others. So that's social anxiety. People they can't function, they can't go out and do things they normally do because they feel people are scrutinizing them, looking at them. Panic disorders, recurrent unexpected panic attack, and persistent occurs and is very worrisome regarding additional panic attacks. This can be accompanied with signs and symptoms like sweating, trembling, palpitations, nausea, vomiting, chest pain, feeling of choking, and etc. Specific phobia, marked fear of anxiety about a specific object or situation. Examples: flying, fear of heights, animals, receiving an injection, seeing blood, and things like that. Anxiety is a very tough situation for most humans. And we have the separation anxiety, which most of us suffer when we're kids. Separation anxiety is inappropriate and excessive fear of anxiety concerning separation from those whom the individual is attached to. The person might have excessive fear or anxiety concerning separation from home or attachment figures, attached people in their life. It might be someone be attached to their boss. It can be someone being attached to their wife, anything like that. You know, treatment of for anxiety disorders. Anxiety-related disorders can be effectively treated. They can be effectively treated with medications, psychotherapy, or combination of both. Medications such as anti-anxiety medications, benzodiazepines, antidepressant medications, SSRIs, beta blockers are used to manage anxiety-related disorders. Things like stress and relaxation skills, yoga, acupuncture, cognitive behavioral therapy, CBT, also can be used in managing anxiety disorder. Okay, proposed practice change. Anxiety disorders are the most common mental illness in the United States, affecting about 40 million adults in America, ranges from 18 and older. Anxiety disorders are highly treatable, yet only 36.9% of those diagnosed receive treatment. People with anxiety disorders are 3 to 5 times more likely to go to the doctor and 6 times more likely to be hospitalized for psychiatric disorders than those who do not suffer from anxiety disorders. Anxiety disorders develop from complex set of risk factors, including genetics, brain chemistry, personality, and life events. Okay. So now, what is the main purpose of this evidence-based practice? I'm talking about exposure therapy. That's where my evidence-based presentation is focused on. So what is exposure therapy? It's exposing a patient to an anxiety source or its context without the intention of to cause harm to the individual. Doing so is supposed to help them overcome the anxiety or distress. Exposure therapy focuses on confronting the fears and underlying anxiety experienced by the patient to help them engage in activities they have not that they're avoiding. Exposure therapy is used alone with relaxation exercises and other imageries. There's several types of exposure therapy out there for the patients. and is most often used in treating anxieties. I know in my experience, I've had a lot of patients with specific phobias, phobias, obsessive compulsive disorders, panic disorders, and PTSD who have gone through exposure therapy, and they were very beneficial for them. And now technology allows the clients to be exposed to anxiety events through computer. Also, we have the narrative exposure therapy, which is also very, very helpful. Presentation of evidence. Campbell et al. 2019 in their randomized controlled trial RCT demonstrated that flying phobia can be treated effectively via the internet. No Fear Airline helps to enhance the exposure technique and provide access to evidence-based psychological treatment to more people in need. This study demonstrated the degree to which an internet-based exposure treatment for flying phobia, No Fear Airline, with exposure scenarios is composed of imageries and sound compared to the waiting group and the list demonstrated in the research study. Santiago et al. Utilized exposure-based therapy in the activation of and dealing and working with patients diagnosed with generalized anxiety disorder. They concluded that exposure-based and individual behavioral activation are successful in treating generalized anxiety disorder. Cahalan, Linda, Nordgreen, 2019, in their non-randomized feasibility and pilot trial, explored the effectiveness of one session 90 minutes VR delivered exposure therapy for adults aged 13 to 16 with public speaking anxiety, and that was also very successful. Manish et al. 2018, this study was carried out with the aim to investigate the effectiveness of narrative exposure therapy on the severity of PTSD and comorbid symptoms of Iranian survivors of MENA disaster. According to this result study, the narrative exposure therapy has a significant effect on the reduction of PTSD symptoms and its comorbidity symptoms. Rudy, Zaru, Junko, and Stock and Lowen, 2017, in their study of parent-led exposure therapy, a pilot study of the brief behavioral treatment for anxiety in young children. The present study examined the preliminary efficacy of the behavioral parent-focused approach to exposure-based treatment specifically adopted for children of age 3 to 7 years in the anxiety. The results of this preliminary study was successful as though participants demonstrated a significant reduction in anxiety symptoms. Recommendations by these researchers for potential implementation. Campos et al. 2019 suggests that internet-based exposure treatment is a useful alternative to the in vivo exposure, providing less threatening ways for participants to confront their fears. They believe that therapist involvement might be minimized for flying phobia treatment using computer-assisted exposure programs. Cahalan, Linda, and Nordgreen, 2019, they suggested that future studies should examine the effectiveness of VR intervention in their randomized controlled trial with a larger population for understanding the effectiveness of the study. In addition to this, they believe that the intervention of self-guided scalability purpose that also need explore limitation benefit of the VR delivered exposure to head-to-head comparison of the in vivo VR delivered exposure. Manesh et al. 2018 suggested that in future studies, other disorders that have a relationship with mania disaster as a major traumatic event, including prolonged grief disorder, should be considered for the study. In addition, they suggested that similar studies to be carried out with respect to cultural consideration in other countries affected by mania disaster. Rudy Zaro and John Cole and Stock Lewin 2017 recommended that future research should focus on further examination of the efficacy and effectiveness of parent-led exposure therapy protocol using a larger sample size for comparison. Further research is needed to improve internet-based treatment that include exposure among their treatment components. On the other hand, Santiago et al. 2020 believes that their research provides a framework for how studies might be designed to move the field towards neuroscience-informed and personalized psychosocial treatments. The implications for practice. One thing I've noted here is that all researchers agreed on the effectiveness of exposure therapy in treatment of anxiety-related disorders. And there's a need they also agree that there's a need for future research to enhance the use of outcome exposure therapy. Majority of the researchers agree that larger number of participants will be useful in further studies. And this is my my evidence-based presentation, and here are the references. Please, if you have any question, you can email me or contact me or